How to get cheap health insurance plan. The U.S. government has proposed many programs and plans to help U.S. people fully enjoy health insurance benefits. Obamacare is one such scheme that provides health insurance facilities for America's high-income and low-income groups. Nevertheless, Washington, D.C. article. The company, named Avalier Health, reports that the cost of one of Obamacare's packages, dubbed the Silver option, would increase by around 34% in 2018. The Silver plan is a decent coverage policy and a bit high on monthly premiums. For those who cannot afford to pay these high premiums, they need not care, as there are plans alongside this and a voucher program that will provide low-cost health insurance. When looking for affordable health insurance plans, one should have good insurance policy information. Shelby George, Senior Vice President for Advisory Services at Manning & Napier, tells customers to always check for how much protection the costs a company provides. In other words, one shouldn't get carried away by the cheap rates, but rather focus on how much coverage insurance companies provide for the cheap rates they advertise. To get the best cheap health insurance, here's an explanation of the different policies and a description of whether you can get free insurance. Subsidies and other health insurance plans. One of the many useful plans proposed by the government is to provide health insurance coverage to all Americans. A premium, in simple words, is the fee paid by the government by insurance companies to provide low-income health insurance services. This means that people falling into the low-income group will enjoy health insurance benefits through the use of subsidies, which insurance companies would otherwise reject on any other short-term policy claim. An adult who makes around $48,000 and a family of 4 who earns less than $98,000 elsewhere are those who can benefit from subsidies. Therefore, with premiums, people with low incomes will enjoy good inexpensive health insurance. Nonetheless, the Trump administration is more likely to change or remove such reimbursement mechanisms introduced by the Obamacare program. Speaking about other health insurance plans, a Silver plan would pay up to 70% of a person's health care premiums, while a Bronze plan would reimburse up to 60% of the bills and the remaining amount of charges will have to be charged out of the person's wallet. So, if one wants to spend absolutely no money out of one's wallet, then having a Bronze plan along with a rebate will be of great help. For those who cannot afford to pay out of their own savings, 60% Bronze plan protection along with the remaining 40% provided by discounts would continue them enjoy cheap health insurance. Which type of policy can one choose? The first move to get the best cheap health insurance is understanding which plan fits one's needs. Here's a list of 2 clearly illustrated choices, so you can choose the best fit. 1. Short-term policy. Short-term policy is for those citizens who are not eligible for subsidies. In other terms, it is recommended to choose this plan for individuals for whom health insurance is unattainable. Here the term unaffordable is described as the cost exceeding 8% of an individual or family's annual income. According to Nate Purpura, the Vice President for Consumer Affairs, Healthcare.gov, people whose salary varies between $49,000 to $69,000 and families earning between $99,000 and $129,000 anywhere should go for short-term policies. Therefore, if it is difficult to pay expensive premiums and use health insurance, it is highly recommended to go for short-term policy. There are no penalties, though, if you don't want health insurance. But, on a positive note, it is beneficial for individuals themselves if they have some financial protection that in unfriendly circumstances will benefit. Here are a few noteworthy details about short-term policies. They usually last up to 3 months and can be extended to 9 months, renewal period of 3 months. Following President Trump's new guidelines, a short-term policy will be compulsory for all persons. The law has not yet been adopted, but will soon be in force. Such plans do not provide protection of pre-existing illnesses, i.e. diseases one faces, until paying for the plan. If you want to include these pre-existing conditions in the coverage plan, the costs would increase substantially. Like Medicaid, short-term plans will not include maternal care costs, neglect accidents, and mental health treatment. If you have a short-term policy, you can use decent healthcare services at about $100 a month. Ultimately, despite the low coverage options it offers, anyone pursuing cheap adult or cheap family health insurance can benefit greatly from this program. 2. combined plan or benefit combo, standard schemes or, in other words, programs with higher premiums must pay all expensive hospital expenses in case of dangerous illnesses or injuries. Meanwhile, short-term plans would simply cover regular doctor visits. But if one wants to take advantage of both plans, i.e. have protection of dangerous conditions as well as common or regular illness such as cough, flu, fever, then insurance companies also provide combination deals. In the recent past, people applied differently for both schemes to use insurance in both situations. It made it difficult for insurers to quantify different percentages and amounts, hence the hybrid insurance plan came about, providing all advantages within a single policy. But, as clear as it seems, opting for these plans would definitely cause one to pay higher than usual. So a summary of all the above discussed points is that one should not always be drawn to deals that simply promise to provide people with cheap health insurance, but instead search for the value of protection they provide for the cheap insurance prices. Shopping for health insurance, like any other insurance policies, involves extensive research and study. Since this is a matter of one's well-being, it's not worth worrying about money. Therefore, one should be smart enough to look for schemes that provide reliable and comprehensive health insurance plans.